Hi everyone, my name is Javier, and in this very short introductory video, I'm going to be sharing with you how I'm already integrating ChatGPT into my psychological therapy practice. But first of all, who am I? My name is Javier Vázquez. I'm a PhD candidate in neuroscience. I hold a master in neuroscience and a master in clinical psychology. Here in Barcelona, Spain, I'm registered as a general health psychologist, number 22614, under the Catalan Association of Psychology. And regarding my training, I got training in CBT, Cognitive Behavioral Therapy, in the Beck Institute with a specialization in addiction. I also got training in emotion regulation when I was taking an internship a few years ago, the James Gross Laboratory at Stanford University. And taking advantage of this same experience at Stanford University, I took several courses about artificial intelligence AI at Stanford. Besides my clinical practice, I'm assistant professor in psychobiology, psychophysiology, and psychopharmacology in the Open University of Catalonia, the UOC, and the Universidad Nacional de Educación a Distancia, the UNED. What am I doing? So I have trained ChatGPT. Maybe you will know this AI from the company OpenAI. So I have trained ChatGPT to act as an ethical and silent assistant in my clinical psychology therapy practice during sessions with my patients. Importantly, it does not replace me, it does not diagnose, and it will only participate during the session if I give him to the ChatGPT permission. Mainly, it will help me summarize sessions, generating reports for me and the patient at the very end of every session. It will help me to organize ideas. And finally, only if I ask for it, it will generate reflective questions, always following a theoretical framework. This is my theoretical framework. So I have added that to ChatGPT. I have shared it with ChatGPT. I have shared the manual for drug addiction from Dr. Carroll, and I have shared the handbook of emotion regulation from James Gross. So the GPT will follow my instructions, yes, but it will follow these instructions by knowing that my theoretical framework, no, by knowing my theoretical framework. So the both of us will be aligned when working in front of the patient, in front of the person. Besides sharing with the GPT the theoretical framework, I have shared with it as well the legal and ethical framework that I am following as a clinical health psychologist here in Catalonia and Spain. These are the laws and the regulations that I am following, and you can see there the general data protection regulation, the organic law on personal data protection. At the ethical level, I am following the ethical code of the Catalan Association and the Spanish Association of Psychology. And besides that, in a future video, I will be sharing with you the informed consent that I have already elaborated for the patient, for letting know the patient about this new and innovative situation, and for him or her to agree or disagree to share the session with ChatGPT. For sure, this is only an option, and I am here innovating, but the patient is not mandatory for the patient to use GPT during our sessions. I have also developed a protocol for how to implement GPT during a psychotherapy session, and a prompt, and this is a very important part of of this innovation, and I will be sharing with you in the near future about the protocol and the prompt and the informed consent. Why am I doing it? Well, I've I've been following Twitter. I've been reading in the news, in the media, that no, there are patients out there, there are persons out there that are already using ChatGPT as a psychotherapist. I cannot be for this option, but in the opposite side, I see some of my colleagues absolutely against the idea of using this technology in psychotherapy for improving mental health. So I am not in one side or in the other side. I'm just flexibly moving in the middle. I think that the AI can add value if we respect for sure the legal, the ethical, and clinical framework. I think that mental health and clinical psychology need responsible innovation, and ChatGPT or other forms of AI can help us to innovate and to offer a more efficient psychotherapy, more adapt to the present moment and the difficulties of the present moment. And we cannot allow ourselves to be replaced, that's for sure. We need to lead as a psychologist or other kind of clinicians this revolution that is bringing AI and technology in the 21st century. So I will be sharing with you more in the near future. You can follow me. You will be able to follow me in my YouTube channel, my new YouTube channel, PsycheGPT, or if you can follow me as well in my X or Twitter account, PsycheGPT. Besides, you can follow me as well in my webpage, drvasquez.org, and I will be, it's already open a new website in where I specifically talking about this project, which is psychegpt.org. I see you, as I told you, in the near future. Cheers.